Hi Heather, I'm Missy. I'm a registered nurse. So let's just go through a couple of the indications and the reasons and the medications that we would be using this for.
Okay.
First would be like a bronchial constriction or hypotension. You would give epinephrine at first sight of that, after you would immediately shut the IV off.
Mm-hmm.
Now, in the outpatient setting, we give it with the EpiPens, but in the inpatient setting, you would draw that up with a syringe out of the vial. You do want to give that either IM or sub-Q. We don't like to give it IV to the patient because just to minimize the cardiac effects that can happen.
Makes sense.
Again, with hypotension, we can also give a normal saline bolus of 500 cc's. And you can give that ×1, but the physician may want that more frequently to try to bring that blood pressure up, and that's okay to do that more than once. Shortness of breath is usually another part of the anaphylactic reaction, so we do implement the oxygen at 10 liters via face mask and also albuterol. Treatments via nebulizer. But if you want to be careful giving the albuterol, because if their heart rate's greater than 110, you do want to hold off giving that until the physician's at bedside.
Right.
At that time, then they will give the directive whether or not they want it or not. We may have what can be the start of a bigger anaphylactic reaction when you see hives, the itching, swelling of the lips or the tongue, patient just not feeling right. Then at that point you want to implement just diphenhydramine IV push and ranitidine IV over 5 minutes, an IV push over 5 minutes. Now, if you do that, you can also give famotidine if ranitidine's not there. And you're giving that just to block the histamine effect. You want to give an H1 and an H2 blocker. So once the physician's at bedside, a lot of times they do want to prevent something to prevent a delayed reaction.
Mm-hmm.
So at that time they'll usually order hydrocortisone or Decadron or methylprednisolone. And we prevent that delayed reaction. And usually patients do very well at that point, at least enough that we can stabilize them to go home or until the EMS does get a chairside to take them to the local ER. A nice thing, even though we have the orders here, a nice thing that we do have with the new policy is an attachment which goes through all the different indications, the drug, the dose that you give, and some comments about why you're giving it and how not to give it. If that
That's
would be
really
the case.
nice. It even says on there about the shortness of breath, not to give the albuterol if the heart rate is greater than 110.
Correct.
Okay.
Yeah. So it's a nice resource, and it will accompany the policy, which will be available on the internet for everybody to see.
Great.
So, do you have any questions?
Where do I document after I've given some medications?
Good question. We document in the outpatient setting. Will we use the flow sheet? And at that time, you would just document on the patient's flow sheet in the pre-medication section. You would put the dose of the medication you gave, the route you gave it, and then the times.
Okay.
And then that goes in the charts, permanent record. But if you're in the hospital setting, you can document on the electronic MAR or the flow sheets that they would use if the MAR is not available.
Okay. I do know that in Sunrise right now they're working on a chemotherapy flow sheet, but it's not available just yet. So I think in the time being, I'd heard someone mention that we would be using the chemotherapy flow sheet just temporarily until we got the Sunrise one available.
Which will be good. They're fairly easy to use, and it's pretty well explained how to get that.
Well, thank you, Missy, for explaining that to me.
Thank you.
Hi, Mrs. Smith. How are you doing?
Oh, I'm short of breath.
Okay. Have you been feeling like this for long?
Oh, for a little while now. It's getting worse, though.
Okay, I've stopped your infusion. I'm going to open up your saline bolus here. Sandy, could you please come into the room for me?
Lisa, what do you need?
Hey, I think we're having a severe bronchospasm reaction here. Can you call Dr. Raymond for me? I'm going to call respiratory and get an albuterol treatment.
Absolutely.
Thank you. All right. I'm just going to get a quick set of vitals.
Okay, Lisa, Dr. Raymond is notified.
Okay, great.
Said-
All right. Mrs. Smith, what I'm going to do is I'm going to give you a shot of epinephrine. It's a lot like giving a flu shot, okay? And we're going to put it right into this upper muscle here in your arm. All right, now this is going to help stop those bronchospasms.
And this is some oxygen with a little bit of medicine in there to open up that airway, okay, and help you breathe.
How's that blood pressure?
It was 120/70. I'll take it again.
Okay, good. Good. Feeling any better now?
A little bit.
A little bit?
Everything's in.
Everything's in. We've had our epinephrine. We've gotten our hydrocortisone. We're getting our albuterol treatment right now. Doctor's aware. Okay.
Wonderful. Pressure's 150/74.
Okay.
Okay, we'll call Dr. Raymond and see what she wants to do, if she wants to restart the infusion.
Right.
We'll leave this blood pressure cuff on.
Mrs. Smith, you feeling better?
Well, it's starting to resolve, I think.
Okay, good.
Okay, good. Glad
All right.
you're feeling better.
I'm going to go call the doctor now.
We're staying here with you. Good morning, Mrs. Smith. How are you today? How's it going?
I think it's going okay, but my IV is a little itchy.
Oh my, okay. Let me see here. Yes, you do have some redness at the site also. I think you're having a local reaction here. I'm going to stop the IV infusion right now. Okay? Any burning or pain with that? No burning or pain?
No burning, no pain, just
Great.
itching.
Okay, great. I'm going to check for a blood return. Excellent blood return, which is a good sign. And Dr. Raymond has given me an order that I can give you some Benadryl to relieve that itching and the redness. It should relieve your discomfort in just a moment. I'm giving that to you now. This is a sign of a local reaction, the redness and the itching at the site. Sometimes the chemotherapy irritates the vein a little bit. The Benadryl should help. How are you feeling now?
Oh, the itching is going away.
The Benadryl might make you a little sleepy though.
Oh, I can take it out.
Okay, that's good. All right, I'm going to call Dr. Raymond. As long as she says it's okay, I'm going to restart the infusion on you, all right?
Okay.
Good morning, Mrs. Mrazek. How are you feeling today?
Oh, good, no problem.
Good. I'm here to check your IV site. Let me take a look here. Oh my, there's some redness at the site here. It looks like you might be having a flare reaction. I'm going to stop the chemotherapy infusion for a moment, not to worry. Any pain or burning at the site?
No, it doesn't seem to be hurting at all.
Okay. You feel all right all over?
Yeah, I think fine.
Perfect.
If you wouldn't have told me it was red, I don't think I would have even noticed it.
Well, that's why we come in frequently to check on that site. Okay, I'm just checking for a blood return. You have an excellent blood return. I'm going to flush you with some saline. And Dr. Raymond said for me to give you some hydrocortisone, which should relieve that redness. I know you're not having any itching or pain or burning, but we want that redness to go away. So I'm infusing that right now. And again, this is a flare reaction you're having, not to worry. Okay. I see it's getting a little bit better. It's pink and it's resolving. I'll talk to Dr. Raymond, and as long as that goes away, we will restart the chemotherapy infusion on you.
Okay, sounds good, Sandy.
Let me know if you have any complaints, okay?
I will.
Thank you. Good morning, Mrs. Jones. How are you doing today?
Ooh, I'm feeling really warm.
Oh my, I do. I see that you are a little bit red. I'm going to stop the infusion here. Okay. You feeling any pain at the site of the IV?
No, it doesn't hurt at all.
Okay. Okay, the infusion stopped. I think you're having a flushing reaction, which is causing the redness and the warm feeling. Kind of feels like menopause, doesn't it?
It does. Ooh.
Okay, you were 110/70 when you come in. You're now 150/70, not to worry. I'm going to initiate our protocol that we have here and give you some drugs. I'm going to check your blood return. Again, you have no pain at the site, no burning. Wonderful.
This is warm feeling.
Okay. I know that must feel very uncomfortable.
It does. Ooh.
Okay. Oh, excellent blood return. Can you feel the saline I'm pushing in? You feel that?
Yeah, it feels cold.
Okay. All right. I'm going to give you some Benadryl.
Oh, Benadryl, that sounds fine. That's probably going to put me to sleep.
I give that to you every 2 minutes. That'll help with the redness and flushing. And it helps with any adverse reactions. Again, you're having that flushing reaction that we often see. Here's some hydrocortisone, a steroid. And again, this is what we give with our protocol when someone's having this flushing reaction. Okay, doing okay?
Yeah.
And I see
It's
you.
warm. I'm still warm, but it seems like it's going away a little bit.
Good, good. Okay. Next, I'm going to give you some Zantac. I know people usually just use this for heartburn, but we also use it as a histamine blocker. If you're having a reaction, this blocks that.
Oh, good.
You should start feeling better soon. You don't look as red to me.
Yeah.
How are you
I feel
feeling?
warm.
You still as warm?
I don't feel as warm. I think it's going away.
Great. Great. You look a lot better. Okay, the Zantac is in. So I gave you 3 medications. And I'm going to recheck your blood pressure. Okay. Let's see here. Feeling all right?
Yeah, I'm feeling much better. A little sleepy, but much better.
Okay. Great. Blood pressure's back down to 110/70. That's where we want it. Okay. Looks like the medicine was effective. I'm going to call Dr. Raymond. And then we'll start the infusion as long as she says it's okay. All right? If you have any further problems, please let me know right away.
Oh, Sandy, I will. Thank you.
You're welcome. Hi, Mrs. Smith. Hey, how you feeling?
Oh, I'm so short of breath.
I'm going to stop the infusion here.
My
Okay?
chest hurts. I feel lightheaded.
Okay. I stopped the infusion, and I'm going to open up some saline wide open, okay? I'm going to initiate. Lisa, can you come and help me?
Hey Sandy, what's going on?
I think Mrs. Smith is having a generalized reaction to the chemotherapy. Can you get vital signs? Or, first one better.
Let's start over, guys.
Sorry. Hey, Mrs. Smith, how you feeling?
Oh, I don't feel good. I feel real short of breath.
Okay, I'm going to stop the infusion here. It looks like you're not feeling very well, but we're here. I'm going to open up the saline wide open. Okay, the chemotherapy is stopped. Lisa, can you call the doctor? I think Mrs. Smith is having a generalized reaction, and can you actually call respiratory 2 and get a nebulizer and oxygen up here?
Sure, I'll be right back.
Okay, Mrs. Smith, we're not going to leave you.
Oh, my lightheaded.
Let me get check vital signs on you.
Oh, my chest is tight.
We're going to do this every 2 minutes.
Oh. I was wondering what was going on.
Okay. Lisa will be in. She's going to put that oxygen on you.
Oh, I got diarrhea 2 times in the
Can you
last
put that
15
on?
minutes.
Oh my, okay. This is a generalized reaction. We're going to stay here with you. We're not going to leave. Not to worry.
Sandy, I've talked to Dr. Raymond, she's aware.
Very good, okay. So, Mrs. Smith, Lisa's putting some oxygen on you. I'm going to give you some hydrocortisone.
I'm going to take your vital signs again, Mrs. Smith.
And oxygen should help your breathing. And there's medication in there also, albuterol, that should open up your lungs and make that more easier to breathe. This is a reaction, a generalized reaction you're having to the chemo. We're staying here. You're going to be fine. Okay, the hydrocortisone is in. I'm going to give you Benadryl also, which is our standard protocol here. This is what we give for this reaction. And next, I'm going to give you the Zantac. I know it seems like a lot of medications, but we have to give this to you. The Zantac blocks the, is an antihistamine blocker.
Ooh.
Okay, this should make you feel a little bit better. Vital signs getting stable, better. Lisa's there too. She's going to take good care of you. in, the hydrocortisone's in, and also the Zantac. And she has an excellent blood return also from the site. So we'll call Dr. Raymond now that she's feeling better and see if she wants us to start the infusion again, all right? But we're going to stay with you, Mrs. Smith. Not